How does this translate now into practical terms? We can look at the chiropractic art or ask the question, what do chiropractors do? In very simple terms, they do the same thing as medical doctors do, and that is they diagnose and they treat. More specifically, we could say that they diagnose and correct mechanical, nerve, joint, and muscle dysfunctions. We can further break down the diagnostic aspects into two parts. First is a general diagnosis. So we use the basic same medical tests and procedures to basically answer two questions, which is this a chiropractic or a medical case? Are there any contraindications to chiropractic care? Is this patient in the right place? Or would this patient be better served by a medical doctor? Does this patient need to do further medical tests? Is referral indicated? The second part of the diagnosis, more specific to chiropractic, is to locate these dysfunctions that I've been speaking about. And in order to do that, chiropractors will use other tests, including the previous tests that we looked at, postural symmetry, gait analysis, muscle imbalance tests. And there's a big emphasis on palpation. So this return idea to the use of the hands. I can tell you that a chiropractor's sense of touch is extremely well developed. To feel muscle imbalances, muscle tension, spasms, joint fixations, range of motions that are fixated in the joints. If and when dysfunction is found, how does the chiropractor then treat the patient or treat the dysfunction? We could say that the chiropractor has different tools available in their toolbox. So first, he or she could use physical therapy, so the electric modalities that we know of, ultrasound, TENS, etc., laser, mobilization techniques, massage techniques, ice, heat. Secondly, exercise and rehabilitation. Studies show that the vast majority of chiropractors do incorporate some form of exercise into their treatment regimen, whether it's in clinic or take-home exercises, or work with a physical therapist or an athletic therapist, or athletic trainer. And third, and what's really central to chiropractic is joint manipulation, or what we often call adjustments. An adjustment, by definition, is a high velocity, low amplitude impulse, or what you may see as a HVLA, high velocity, low amplitude. So what exactly is this? Well, if we look at the motion of a joint, we'll just take my MCP joint here as an example. We have a specific active range of motion. We can then look at the passive range of motion, which goes further. And the chiropractic adjustment occurs at the end of this passive range of motion. So although I'm demonstrating this here, it can occur anywhere in the body. Any mechanical joint that has movement in it can be adjusted, can be manipulated. This adjustment, or rapid impulse that's put through a joint, is a very precise maneuver. It's a skill. It's highly refined. And it can be accompanied by the infamous cracking sound or the popping sound, very similar to you see people cracking their knuckles. What actually happens with this, it's called a cavitation. And the cavitation is simply a change in pressure within the joint due to the movement of the bones, which creates a vacuum effect, releasing bubbles from the synovial fluid. And it's this release of bubbles that causes the sound. It's also important to note that there's many different types of adjustments. There's actually dozens of different chiropractic techniques. So although I've just described the more traditional version, there's actually techniques that serve different types of patients, different conditions that patients have. So I don't treat a little old lady the same way that I'll treat a child or the same way that I'll treat a professional athlete. Everybody gets a catered treatment. So we could say that these three aspects really serve to restore function, the first goal of chiropractic care. The next one really helps to optimize health, the second goal of chiropractic care, which is prevention and education. So it's important to discover the cause of the person's chief complaint. Why did this happen to this patient? How can we avoid recurrences? Does the patient need to be taught proper ergonomics? Does the patient need to be taught proper postural habits or lifestyle changes?